Alrighty, well, we have great honor of having Mr. Jeff Oxenline today. He is the founder and CEO of Health Career Connection, who founded when he was still in grad school, right?
A
And
little bit afterwards.
uh, and has been involved with it ever since. Even was kind of his passion project, even though when he was dean of UC Berkeley School of Public Health for a long stint and managed their practice and but he's been very passionate about healthcare connections and it's kind of his he calls it his life work and he's been involved in numerous statewide and national health career and healthcare committees appointed by various governors and leaders to lead the conversation. So we're lucky to have him. I know he's a really busy guy, and I know he doesn't do a lot of these sessions, and we're just not always honored to have him come and make time for us. So, and someone that I also could call a friend. So,
Absolutely. Thank you, Jubin, and thank you so much for having me. And great to be here with all of you. I always come when Mr. Afsar calls, and we had a long-standing relationship and friendship, and really admire the work that PreMedCC does, and compliment all of you for being able to be part of it. So, yeah, great to see let's see who's here. Please fill out your poll, and then we'll see who's here, and then I'll tell you a little bit about me, and then we're going to talk the rest of the time about you. So, yeah, go ahead and complete the quiz.
it's a short little poll, but they could do it while you talk. We have as soon as they come, they do it. They're a little shy group. Come
Okay.
on, we're almost there. But yeah, you could continue. We'll
Okay. All right. Well, it's helpful to me to see who's here too. Then I can adjust my comments. And so, Juba, I'm assuming you'll go ahead and share
yeah, I'll
me
share it. Yeah.
Okay. All right. So just quickly, a little bit about my background, because I think it'll help to know, for you to know where I'm coming from. So I'm from Fairfield originally. I'm not sure if anybody's from Solano County, born in Vallejo, raised in Fairfield. I was not a great high school student, unlike probably most of you. I was more of an athlete, and I was a little bit of a partier at the time, which wasn't the best combination, but it worked out okay for me. And I ended up being pushed, shoving, and screaming into college by my parents. I went to Chico State as an undergraduate. I was fortunate that Chico had a health management program, and I started out as a PE major, really undirected, not knowing what I wanted to do at all, because I came from a community in which people weren't exposed to what careers there are out there. I didn't know anybody who was a professional of any kind. The only person I knew who went to college was my mother, was an elementary school teacher. So I really didn't know what was possible. So part of why I do what I do is I want all of you to know what's possible for you, because there's so much you can do in the health field, and we need you. There's so many shortages of health professionals now, and they're only going to worsen. There's so much need to improve the health of our community, to have the community have people who have the lived experiences, look like the community, are place committed. So I want you to know what's possible, to know how much you're needed, to know how much you belong in the field, and then to help you choose what I call your authentic health career, the one that best suits your unique talents, passions, goals, and lived experiences, to make a good choice about that. And also the life that you want to have too, because these careers have different life implications as well. In my case, I was really fortunate to stumble onto this health management area. I was not somebody who could be a doctor, because I wasn't great at science and math, and I'm still not. And I wasn't so excited about blood and those kinds of things. But I was passionate. I got passionate about health management and public health, because it was about improving the health of underserved populations, increasing access to care, particularly for low-income backgrounds. I'm from a Native American tribe, the Lumbee Indian tribe of North Carolina. So my family has a lot of health challenges, a lot of health access issues. It's a rural community, so I know what it's like, to be in rural. And so I just really wanted to improve health access and improve health for all. That's what motivated me, and public health was a way to do that, and to use my talents that were more on the management policy program side of things. And so I was fortunate to have an internship between my junior and senior year, which changed my life and launched my health career. I worked in a hospital, which is I had wanted to go into hospital administration. I got to see what it was like to be in the management roles in hospitals and see that I was good at it, that I liked it, that there was a need. I got a job from it. I got a uh, letters of recommendation for graduate school. I got mentors that supported me, connected to UC Berkeley, where as a Chico State guy, I'm like, hey, my dream was to go to UC Berkeley. Is that something I could really do as a Chico State guy from Fairfield? And fortunately, I really applied myself after the internship. Did great for the rest of my school because I knew what I wanted to do. This comes back to understand what your authentic health career path is. And I had help understanding how to write those statements of purpose and how to get the letters of recommendation and all those things. And so I ended up getting into Berkeley in the MBA and MPH program. I was somebody who said I would never get an MBA. So good thing they didn't have iPhones and videos, cameras back then, because I thought, oh, MBAs were the problem. The reason why we didn't have good health access and we had bad health outcomes is because it was more corporate oriented. But my mentors told me, you know what, health, whether we like it or not, and I want all of you to listen to this, health is a very complex business. And if you really want to make change, you have to understand how the business and the financial part of health works. How does reimbursement work? How do all the players fit together in order to make change? And they'll say you'll be a better hospital administrator, be a better public health professional if you have the business background, in addition to the public health background. My passion was public health. I wanted to have the combination of those two things. And it worked out great because I did learn the business side of it. I learned the business language, the way to think about approaching issues, how to make the business case to for investment in programs that I cared about. And I still learned more about public health and built that public health network. I got a job at Altice in Berkeley when I graduated, which was my goal to work in that kind of a hospital. I was a hospital administrator, vice president. I went on to running a physician group. I didn't know the doctors in their groups had business people who ran those groups. So I ran radiology groups for a while and cardiology groups and pathology groups. So worked a lot with doctors, but I was the business person working to help improve the care that they provided and their lives. And then finally, I started teaching on the side at UC Berkeley, actually at Chico first. I went back to teach at Chico and then Berkeley on the side as the professional person coming in to teach in the academic setting. I discovered I love teaching. I started up also that program I had been in, that internship program I had been in. Well, the funding for that ran out. So I and two other people who'd been in that program and one of our business school colleagues, we started up what's now Health Career Connection. That's 35 years ago. And so that's where I started working on the student side of it. And I found that, well, I love teaching. I love working with young people to pursue their health career journeys. I wanted to, give more chance for people to be in the health workforce. And so then I made a big pivot from being a health executive after 20 years to go teach at UC Berkeley, where I was actually the associate dean of the School of Public Health for the practice part of it and ran the leadership center and a number of other things. And I was a faculty member in health policy and management. So I worked at Berkeley for many, many years. I still did HCC on the side. Then I started working with Jubin on health workforce and diversity issues throughout California, along with some others as part of the California Health Professions Consortium, which I still co-direct with Dr. Catherine Flores. And so I did that for many years. And then I just decided to focus on health workforce issues on the state level and running Health Career Connections. So that's what I do now. And you'll hear a little bit more about HCC, but we focus specifically on college students like you, those of you who are in college. High school will be waiting for you when you get to college to help you discover your authentic health career, just like I did, achieve your health career goals, just like I was able to, launched by that internship that I had, and have mentors and have key supporters and have a network of other people to help you succeed, going forward, and to really know what's possible, and to make it happen for you and your family and have the life and the career that you want. So that's what I'm all about, and also just building the health workforce that we need for California and beyond. So what I'm going to do now is I'll pause and see if there's any questions so far, and then I'm going to go into a little bit more about some of the health career options, because I want you to, again, to know what's possible for you. How do you make that choice? And then at the end, we'll talk about internship opportunities with Health Career Connection specifically, and how you can apply and hopefully get into that program. But any questions or comments so
Yeah,
far?
this is one. This is what's the single most effective way early on during your undergraduate community college to build relationship with physician, mentor, researchers, or healthcare faculty that
Yeah.
last beyond shadowing?
Okay. Well, so I think the things that I would suggest are I think a few key people to build those relationships with. The first would be your faculty in your whatever program in school that you're in. And that's when I was at Chico State. I was fortunate to have some great faculty member that were in my program. I was really uncomfortable going to office hours. At first, I was like, "Oh my gosh, that's really scary, and what am I going to talk about, and are they going to reject me, and those kind of things." But then I start once, and at first it was pretty uncomfortable. I have a saying that when you're uncomfortable, you're about to grow, and so it's a little sign going, "You're about to grow." And so I went into the office hours, and I would be nervous, and I wouldn't say very much, and kind of smile and nod my head, and then but over time it became more comfortable. So I developed relationships with the faculty, which was really important, because that internship program that I got into that changed my life, well, guess what? I found out about it by going to see the faculty member in her office hours, and she had it on the wall outside of her office, the flyer for it, and it was due the next day. The application was, and so fortunately, I had a relationship with her that she was willing to write me that letter like on the spot. Yeah, I had a letter of recommendation, and since I'd been going to her, first of all, going to the office hour, I saw that flyer, and then secondly, since I had a relationship, she was willing to write that for me. And then she and other faculty members connected me to their colleagues and alumni of our school for informational interviews, which is the second big thing I would just say is try to do informational interviews with people. Use the magic words. I'm a student at X. I'm interested in your organization and your role. Can I do an informational interview with you? Not can I have a meeting with you? Because people are like, okay, why do you want to meet with me? Or even shadowing. Shadowing has other implications to it, right? There's a lot more that people have to let you come see patients and all that kind of thing versus, hey, an informational interview means you're just going to get information about their job and their career path and their advice for you. 30 to 60 minutes, depending on their time. Oftentimes make it for 30 and then they'll talk for 60, because once you get people talking about themselves, they like talking about themselves, they're going to like you. And then what you do is at the end of that time, and you go in prepared with questions already about what you want to ask them, and not stuff that you can read on the website or their bio, but other questions like how do they get to where they are? What do they like about it? What advice they have for you? And at the end, you always ask them, so what are there, now that you know who I am and what I'm interested in, are there two or three other people you could recommend that I do informational interviews with in order to keep that way you get to access their network, and then you could, hey, can I use your name or can I have your email or something like that? Then you link in with the person that you did the informational interview with, and now they're part of your network, going forward. And so that's really important as well. Then the two other ways are to have an internship, like a HCC internship, which is a lot longer than a shadow, right? Like you go shadow somebody or an informational interview, that's a quick transaction. But if you are to be able to get an internship for anywhere from 6, 8, 10, 12 weeks, the HCC ones are 10 weeks, then you're longer in that organization and you get to build deeper relationships with people, and you can spend more time with them. They're more willing to help you. They know you better, and they can and you can ask for more clinical exposure and those kind of things. And then finally, when you do the clinical exposure and the shadowing, which I still encourage you to do, you got to follow up with people. You got to thank them for doing it. And then you want to stay in touch and just give them little updates. I got one the other day, which was really cool from one of my students. She's like, "Hey, I just finished, I'm about to finish my first semester." She's in the Brown University Master in Public Health program. "Hey, I just finished my first semester at the MPH in Brown, and boy, that advice you gave me was really helpful. And I'm doing X, Y, and Z, and I really love it." And you don't need, the people don't even have to respond, but you just want to stay on their radar screen so that when, next time you're back in town, see if you can buy them a cup of coffee or come by for an informational interview. But once somebody is in your network, you want to keep them in your network, and you need to have a system. Networking is a system for keeping up to date with them about what you're doing and how they can support you. So those are some of my advice. Oh, one other thing is being part of a club, a student club of some kind. Like I was part of the Health Professionals Club at Chico State, which is, as a couple years ago, I was one of the people who started it. It was still going, which was pretty cool. And we would invite guest speakers in, and we would have networking events. And then as the people in the club would get to know those people, and you get to invite the speaker, you get to walk them out to their car afterwards, you ask for an informational interview afterwards. So the more you can put yourself in the flow of people and opportunities, the better. Any other questions, Jubin?
No, I would just add that most of your, by the way, I posted the number of people, the breakdown. I would say most of your faculty have taken OChem and general chem, certainly in the sciences, and they have friends. One of the funniest
Mhm.
things for me was my chemistry professor, no, my OChem professor, uh, when he was doing his PhD, his roommate was a medical student who basically was failing biochemistry and only passed because of him. Well, sure enough, years later, that person is now dean of a medical school and
Right?
connected me with them because they knew that I was pre-med and I was interested, and so he kind of connected me with them. And it wasn't something that he was forced to do, but we just got to know each other between classes. I mean, if you're taking organic chemistry, that you're with that professor for at least 10 hours a week for
Mhm.
16 weeks. That's 160 hours in a semester, not including going to office hours or anything. And at most community college, usually only one organic chemistry professor teaches that class. So
Mhm.
you may have them for 320 hours for the whole year,
Yeah.
not including office hours or anything. That's a big gap amount of time. And if they don't know you, and if you haven't talked to them or asked them questions or anything like that, that's like the first place that you can start. You don't need to go for all of these like higher level of things. This is just the first place you can start. Then if you get into an internship, you make connections with people and you get introduced with folks and you kind of move on, but it just doesn't like magically happen. Somebody wants to know, what internship were you part of when you were an undergrad?
Sure. Yeah. And let me say just one other thing about what you mentioned about those professors that you're spending time with. Just for you to fast forward and think ahead, when you apply to medical school or any kind of graduate school, you have to have letters of recommendation, and you have to have letters of recommendation from academic faculty. And if you do what Jubin mentioned, is going to spend time with them, getting to know them, then when you come back to them and ask them to write a letter of recommendation, you have to actually ask them, can they write you a strong letter of recommendation? And the first question that they have to answer is, how long have you known the applicant, right? So let's say that to his example, you had this chemistry professor that you had in your freshman or sophomore year, and now you graduated, you're doing your gap year. And so that person has known you now, if you keep in touch with them for 4 years, right? Or 5 years or something like that. That looks really good when they write that letter. Oh, I've known this candidate for 5 years. They used to come to talk to me in office hours. They've talked to me about their career plans because the other thing is you want them to talk about you beyond, hey, you were in my class and you got an A in the class because you were a smart student. I know this person's passion for medicine. They've talked to me about their why they want to be a primary care doctor. Like you want them to write those things in your recommendation, and that takes you having the time, making the time and having the courage to go get to know them in the way that you've been talked about. So. Yeah, and so then the internship program I was in doesn't exist anymore. That's why I created a new program. It was called the Fellowship Retention Program in Health Administration. It was put on by the healthcare executives of Northern California and UC Berkeley School of Public Health. It was funded actually by a Health Career Opportunity Program grant funded by the Health Resources and Services Administration of the federal government. So that grant ran out, and so therefore the program went away. So that's why my colleagues and I started up this new nonprofit and came up with our own funding sources to run the program.
Um, this is another question is, um, do you need do you, do we need to have any experiences before starting to seek an internship in the medical field?
I think it depends on the program that you're applying to and what they're looking for. One of the best programs, if you are a freshman or a sophomore, is in which case no experience is required, is the Summer Health Professions Education Program, SHEPEP, Summer Health Professions Education Program. It's run through the American Association of Medical Colleges, AAMC, which hoping you all are familiar with anyway, because it's the place where the best information is besides PreMedCC about the getting applying to medical school. But Summer Health Professions Education Program is specifically for freshmen and sophomore. And it's a great program where you get an internship, but you also come together with a cohort of other students and you work on, the kind of things that help with your pre-med preparation and health career exposure. Not sure if you get an MCAT prep class out of it or not, but really a good program. And that one you don't need any experience in. For Health Career Connection, you don't need experience to apply for Health Career Connection. There are other things, if experience doesn't hurt, but it can be experience in like, hey, I was in my running my student health professionals club, or I was involved in my church in a health fair for people in our community, or worked in barbershops doing outreach, but you don't have to have experience to be in Health Career Connection either. Uh, and so it really depends on the program. And people know that at the undergraduate level, it's not easy to get experience. And so there's a lot of programs where, I'm not sure if Stanford is still running their program for community college students. You may have heard about that already. But they have a great program for community college students that come to Stanford and do research in the summer and that are interested in pre-health. So most of them don't require experience. Sometimes people who are in their junior or senior year have a little more academic background under their belt, and they have a little bit more experiences and a little bit more um, just life maturity. So there are times that certain programs, like Health Career Connection, actually uh, we do tend to favor students who are going between their junior and senior year, or they're graduating, or people between their sophomore and junior year. But that's more of an overall preference, but not a requirement. All right.
Yeah, and the people that built these programs, they absolutely know that you don't have experience, so they will tell
Mm-hmm.
you like we need to have at least like some research programs will tell you they want you to have at least a year of biochemistry, but
Mm-hmm.
programs like this are built for that reason. Certainly, like the SHPEP.
Mm-hmm.
We have like I think we've posted something over 50 summer programs on our social media accounts, and um, and those are a lot of programs that you have to do your own research. The infamous words is doing your own research. Um, but yeah, and it said what hours are best to volunteer experience to stand out? Um, it just depends. I mean, like, obviously, if you're in a formal program, they will have hours for you. It's not like whenever you want to show up. Um, but also, like, I know if you want to volunteer in the ER, those hours are wide and ranging. It's just how you make it fit into your schedule. If you're part of a formal program, um, they will like tell you what hours you need to show up because they're paying you, so it's kind of a job. So it's not like um, but Mr. Oxendine will go through those. Um, how do we? This is a good one. How do we reach out to a professor we had a couple years ago to write us a letter of rec?
Hmm.
Especially haven't been in contact with them when you were in a class and you were you did well in the class and attended office hours. So let this be a lesson for everyone is you need to start like keeping track of who you want to write your letters of recommendation and and continue keeping in touch with them, just even
Mhm.
sending them 2 or 3 updates a year saying, hey, I'm doing XYZ. Hope you're doing well. If you know them personally, hey, how's your dog doing? Or how the kids doing?
Mhm.
But if I would say, hopefully, your first email should not be to them that you want them to write them a letter. Try to connect with them if you could meet with them over, Christmas break or winter break or Thanksgiving or any other time you can. Um, and if you can't, try to set up a Zoom. I mean, we've got Zoom, Skype doesn't exist anymore, but it's Microsoft Teams now. Um, but yeah, do you want to add any more?
What you said was just right. I think first of all, it's back to what I mentioned, which is kind of getting over that initial discomfort potentially, or just taking the initiative to get to know your faculty member when you're in the class and or your TA. Like if going to a big university where you've got big giant science classes and or public health classes, and there's a graduate student who's a TA or something like that, get to know them too, because they could potentially write you a strong letter of recommendation and or get it co-signed by the faculty member. But then I think exactly what Mr. Afshar said is to say, hey, I'm just reaching out to you, just to let you know your class was really impactful for me. I really enjoyed it. I'd love to get together with you to kind of give you an update on where I am in my career journey, and hoping I can just stop by for a cup of coffee or for your office hours or have a Zoom meeting or something like that. And then after you reconnect with them, you tell them this is what I'm doing. This is why. Here's how you influenced me. Then, assuming it goes well, then you might say, and by the way, can you write me a strong letter of recommendation? I'm going to be applying to medical school next year. Don't try not to do it like when you're a month or two away. You want to do this like 6 months or a year before you're going to need the letter. I agree with Mr. Afshar is to go ahead and identify who's going to be your letter writers and really keep in touch with them over time. But yeah, it's okay to go back. It might be a little uncomfortable. They might not respond right away because they may be dealing with all these like immediate students. I have one faculty member at UC Berkeley who, I kid you not, she's one of the busiest people I know, and she writes 60 letters of recommendations for students in the fall for graduate school. So for someone like her, you need to get on her list many months in advance and reestablish that relationship many months in advance. So anyway, yeah, but please, it's fine to go back to them and get that. All right, how about if should I go ahead and share a little bit about the health career options and then
Yeah,
HCC?
start that. Yeah,
Then we can just
yeah,
have
yeah.
a total conversation. And we have until 2:30, right? Right, Jubin, is that right? Or what time?
However much you want to stay, you can stay here till 10 o'clock at night.
Okay. All right. Well, I want to make sure that everybody's getting what they need. So let me just share. I'm going to share my screen and go through a little bit more about like what remember. I want you to know what's possible. So I'm going to share some of what's possible and what's needed, and then I'm talking a little bit about how to pick, and then we'll talk about HCC. So bear with me just for a little bit. If I can share my screen, would be great. All right. Let's see here. So. So these are folks that were part of the Health Career Connection program that I run. They're all smiling because they are living their authentic health career. In this picture are people who are doctors. The woman who's standing next to me is a adolescent medicine doctor who in New York City who also has her MPH from Columbia in public health. A lot of the people that come through Health Career Connection start out being interested in pre-med and they end up going, oh, wow, I want to be a doctor and I want to get that public health degree too, so I can understand the population health side of things or be in management or policy or something, maternal child health, something like that. There's also people in this picture who are nurses, who are MBAs, who are MPHs. And so I'm showing you this because these are folks that may have started out in similar places to you and they are living their authentic health career. What I'm going to ask you to start here is to just say, hey, here's some of the workforce needs going forward. And you can see this is some national data on what's going to be needed. And you could see, how many, there's a lot of need for physician assistants, for nurse practitioners, for all kinds of physicians. I mentioned my background is in health administration. So you can see the number of health administrators is projected to go up by 28%. A lot of the people who are running health organizations, and meaning like people who are the managing in hospitals and clinics and health departments, they're in my age group, they're going to be retiring. And so there's a lot of new jobs that are needed. These are really good jobs. The average salary of a hospital administrator in California is $800,000 a year. That's the average salary, which meaning there's above and there's below. But that's a good field. And you have it's a hard job and a hard job to get to, but you have a lot of power over who gets hired and what the organization focuses on and their policies and all kinds of things. We need people in public health. Look at that, 100,000 more public health folks could leave this year, and there's a lot more jobs needed. And then, there's a lot of the aging population, and so we're going to need more folks. That's where you all come in. Jubin mentioned that I spent a lot of time in California leading initiatives to identify like what are the hot and emerging clinical career paths. These were the ones that have come out from the California Future Health Workforce Commission and beyond, that are the ones that they're hot and emerging because there's shortages already. There's even greater shortages in places like the Central Valley and the Inland Empire, the far and rural and desert areas of California. But these are the careers that people are saying, hey, we're going to need more primary care practitioners, whether that's a primary care doctor or nurse practitioner or PA, or team members like medical assistants. We're going to need more behavioral health practitioners. There is no health without behavioral health, which is mental health and substance use. My Native American tribe, behavioral health issues are really the top health issues that we're dealing with. We need people that are in clinical lab scientists. So those of you who are in who have a microbiology background, clinical lab scientist is the hardest to fill position of any position in the hospital in California. The average age is even older than I am. They're in their late 60s and early 70s. Definitely going to need people in pharmacy, a need for imaging techs, radiology, CT, MRI. Those of you who want to kind of have a combination of technology and people, imaging is a hot field, ultrasound, those things. Nurses of all kinds are needed, not only RNs, but also specialty RNs in ICU and OBGYN and the OR and the ER, those kind of places. And we need people that are going to go in to take care of our older populations and people with more complex diseases. A friend of mine unfortunately just passed away and had really amazing hospice care, which was incredible to him and his family. And then we still need people in oral health and PT. So all of these are hot and emerging paths that you could see yourself in. I'd be curious in the chat, if any of these are of interest to you, put in the chat which ones of these you are specifically interested in pursuing. I mentioned behavioral health. You don't have to be a doctor to be in behavioral health, but you can. You can be a psychiatrist, like some of our HCC alums. You can be a doctor of psychology, or you can be a master's prepared person in clinical social work, as a marriage and family therapist or a licensed professional clinical counselor. a nurse practitioner. And in California, we have a whole new position. It's actually called a wellness coach. California has created hundreds of new roles and a certification as a wellness coach that you at the community college level, you can become a wellness coach one. At certain CSUs, you can become a wellness coach two. And these are roles that are now going to be out of those levels of education, playing a role in behavioral health on your way to other things. And then you can either get it at a community college, you can become a peer support specialist. Someone has lived experience or a family member has lived experience, and you can become a substance use counselor. So these are all in-demand roles. If there's any of these behavioral health roles, we need you in behavioral health. Please indicate any of these behavioral health roles that you're interested in the chat. You don't have to be a clinician. As I mentioned in my case, I pursued health management and I managed physician groups and hospitals. And now I use my management skills to manage a nonprofit. I manage in an academic setting. So you can be a management person or a policy person. Now that I'm a little further along, I started out as a management person, but I can see how you can really influence people through policy and really how important that is at the state level, at the federal level, at the county and city and institutional level. So I encourage all of you actually, even if you are interested in being a clinician of some kind or a technical expert in some kind, to also become a policy advocate, somebody who is skilled, who is committed, who's capable of making policy change. Policy dictates who gets covered, what they get covered for, what level of payment is made. We have changes coming on the federal landscape about Medi-Cal and Medicaid and Medicare coverage and cuts and those things. They need policy people like you in there working and advocating for the issues and the communities that you care about. Social work, a huge need. Our country doesn't spend enough on taking care of people's housing, their food and nutrition, their transportation, their just social needs, right? And then for those of you that like data analysis, you've got an amazing opportunity with all big data, with AI, with digital health. There's so much you can do, and some of you are going to be entrepreneurs and start up your own nonprofits or your own businesses. And I do encourage you to think about consulting, especially even those of you going to medical school. When you come out of undergrad, there are consulting firms. I didn't even know what consulting was when I was in your shoes. I had to wait till I was in business school and graduate school. But consulting firms provide support to organizations to help them with expertise that they don't have, help them with capacity they don't have, or political. And so a lot of consulting firms hire people out of undergraduate. You get great skills, great training, and then you can go to medical school or public health or business or law or something like that. So all of these are hot and emerging paths for you to get exposed to and figure out what you want to do. And so public health is what I'm going to encourage you to think about, that in public health, and again, I told you my story that I became passionate about, hey, there's disparities in health. A lot of these are rooted in historical inequities. Public health is about keeping the population healthy and improving population health, in addition to supporting individuals. And many of the things that are the biggest issues in our populations are preventable. So I would love to, anybody who's interested in prevention, raise your electronic hands or put it in the chat, because I got motivated by preventing, cardiovascular disease and diabetes and certain kind of injuries and infectious disease. And those are all preventable. In adolescence, the three top causes of death for adolescents, are all preventable. And so public health is about prevention. It's about working upstream. It's about social justice. And you can do well by doing good by going into public health. In public health, you can be in management and policy. You can be in like education and community health, or you can do like epidemiology and biostatistics, infectious disease. You can do on the nutrition side. And of course, we've got climate change. We've got wildfires. We've got drinking water and air issues and the environment. All of these are huge issues. So you can see there's something in this for everybody. The key for you is to figure out which is the right path for you. You can combine being in public health and medicine. This is my friend, Dr. Muntu Davis, who is the chief health officer for LA County. This is him. He combined being a primary care doctor with his desire to improve public health and population health. And so he is the public health officer responsible for the health of everyone in the country of Los Angeles, right? But you can be lots of other things. I think the best doctors are going to be people who have a public health degree and a physician degree because you'll understand what the factors that build healthy communities and keep people healthy, and you will still be able to treat individual patients. And the future is in having people who understand how to improve the health of the population as well as individuals. You can also be a more effective policymaker or professor or clinician in order to do this role. We need to work on social determinants of health, like affordable housing and jobs. This is also areas, the things that impact health the most. Health access, which is what motivated me to come into the field, is only about 15% of what influences people's health. I mean, you need that when you need it, right? But these other things, making sure there's healthy neighborhoods, people are educated, people have jobs, they have hope, they have opportunity. These are the things that really impact health. So you can work in all of these areas. The question is, how do you decide? So one of the things I did, I wrote a book a few years back called You Don't Have to Be a Doctor. Don't let the title scare you. It's not trying to talk you out of being a doctor. In fact, it's trying to help you make a well-informed choice if you want to be a doctor or one of these many other things that you can be. It's not an academic book. It's a very practical book with stories about people who've made choices about becoming doctors and other health careers. It helps you understand how to get from where you are to where you want to be. And for the cost of less than your dinner tonight, $9.99 for the ebook, like say $18 for the other book, you can have a great book that will help you with your career journey, available on Amazon. Because my job now is to help you to make a best choice about what you want to do the first time around. We talked about prevention. This is my prevention, is helping you make a good choice about who you really are and what you want to do for your career now, rather than waiting until you're like one of my former interns' brothers who graduated from University of Chicago Medical School, $200,000 in debt, and decided he wanted to be a brewmaster instead of being a doctor, right? So we don't want that to happen to you. So I believe and I know that you can have what's called your authentic health career path. It's the one that suits your unique talents, passions, goals, your lived experience. There's only one of you in the entire world. So we want you to pick the path that's authentic to who you are, right? Not just what your parents want you to do or what you thought you wanted to do that really isn't what you want to do or what your friends are doing. What's the right career path for you? And Steve Jobs, who made a little bit of money, my laptop and my phone and all those things are from him. He did this great commencement address at Stanford saying, you don't do what other people say you should do. Your time is limited. He only lived to be 57. Have the courage to follow your heart and intuition. They know what you want to be. And so that's a nice fluffy thing to do. But the other realities are, and it's not fluffy, it's actually very, very compelling. But it's important to make a good choice because going to medical school is a wonderful, amazing, incredible, powerful experience. And you're going to spend your 20s and your early 30s doing that. One of my HCC alums is a primary care doctor doing exactly what she wants. And she said, Jeff, tell them that it's actually their 20s and their early 30s. She got her first job out of fellowship when she was 34 years old, right? So you're going to give a lot of your life energy. Make sure it's the right fit for you. And graduate schools are looking for fit. If you come to PreMedCC, I know the admissions directors of all these medical schools are telling you, hey, we're not looking for box checkers who did all the right things. They worked in a lab, they got a publication, they went on a mission trip, they got a good MCAT score, those kinds of things. They want to hear in your authentic voice what you really want to do, and it makes sure that it's aligned with who you are and what you want. And so it'll even affect your health if you're not doing the right thing. At one point, I was on paper, I was teaching at Harvard. I was working at a very prestigious job as a hospital administrator at a Harvard teaching hospital. I was making a lot of money and I was miserable. I was coming home every day going, oh, I was grumbling all the way to work, grumbling all the way home because I wasn't living my authentic health career. And I went to the doctor and the doctor looked at me and he goes, wow, you're here for a sore throat, but you look really, really sad and depressed and tired. And I was, because even though I was doing something I was good at, and I had done for 20 years, it wasn't my authentic health career. So more about that in a minute. So how do you find your authentic health career? And I'm going to share you this and then Then I'm going to go on to the internships here in a minute. But the key here is for you at your stage of your college career or your high school career, you want to work towards finding out what's possible. That's the top of the triangle. What do people need? That's why I started with what are the hot and emerging health careers? Because for you to decide on your future, you want to know what are going to be the careers that are going to be there, that are going to be the high demand, the high wage, the high impact health careers that are going to best suit you. And you got to think about how AI is going to affect that going forward. But if you can understand what you really want to do based on the needs that are out there, and that's the top of the triangle, and then what aligns with your passions, your values, your goals, and your lived experiences. So that's you. You're unique. How hard do you want to work? How much time do you want to spend with your family? How much money do you need to make? How much time do you want to have to do other kinds of interests, right? What are you most passionate about? And then what are you good at and enjoy doing? Not just what you're good at, but what would you do for free? What would you do because you're so passionate about it, you enjoy it so much? Put teaching in the center of what I did because I loved doing that work, right? So if you can find the alignment between these things, then you can have the rewards in the middle of the triangle there, purposeful work, fulfilling work. The financial rewards will come if you're doing what you're supposed to do. Like the hospital administrators make way more money than most of the doctors do. And if that's what you're really good at, then that's great. The money will wait, the money will come. And in my case, back to the health and wellness part, remember I told you I was feeling kind of burnt out. Doctor was concerned about my health. I went in, even though on paper everything was perfect, right? But in my case, I decided, I'm center of what I really do, what I'm really good at and enjoy doing, what there's a need for, and what I'm passionate about, what my values are, is to help students like you discover and achieve your authentic health career and teach people how to become good leaders and effective public health and healthcare professionals. So I took a 70% salary cut when my third child was on the way, moved my family back from Boston to Berkeley. And that's where I took on my job at the Berkeley School of Public Health and put in the center what I wanted to do. Not only was it really what I wanted to do and what was needed, what I was good at and enjoyed doing, but also it allowed my values. It allowed me, I have three children. It allowed me to be a better father and a better husband, a better son, and to have more life flexibility as well. So you can find that alignment just like I did. Sometimes we're just surviving. We're just trying to get through organic chemistry. We're trying to deal with this challenging environment that we're in. We're trying to deal with ice raids and those kinds of things. And sometimes we're searching. It took me probably 3 to 5 years to make that shift I mentioned to you. Sometimes it's all in alignment. So realize it's a process. And I encourage you to be bold. This quote came from one of my friends who had his birthday yesterday. He survived some really nasty cancers in his life. He's also started and sold 3 companies. He said, Jeff, just tell folks to be bold. Mighty forces will come to their aid. And you're exactly where you're supposed to be. So whether you know exactly what you want to do and you're like, hey, Jeff, let's get on to the internship, or whether you are more confused than ever, like I was, like when I was a sophomore, for example, in college, you're where you're supposed to be. Just take that to heart. The key is to move forward with intention that you can have your authentic health career and you have options to do it. So now I'm going to just share with you how to proceed to get that authentic health career, and then we'll talk about internships. So this is my life career planning framework. It's the basis for my book. There are 9 steps to the framework. There's 9 chapters in my book. I've used this model with over 12,000 people now to advance their authentic health career, including undergraduates and graduate students and health professionals. And that's the pathway to your authentic health career. And it all starts with, like you're doing today, getting as much exposure to what's possible so that you know what's possible. Remember, my whole thing is if to see it, to be it, you got to see it, right? So your job number one from where you are is to get exposure to what's possible through internships, through shadowing, through informational interviews, through volunteering, like all the things we talked about earlier. The second is the bottom of the triangle. What are your values, passions, and goals? What are you good at? What is it what's your why for being a doctor? What is it really? Because you're going to have to articulate it when you apply to medical school, both in your application and the interviews. Like, what is your true why? And if pushed, is that really your why, right? So who are you and what do you really want? and what are you good at? Then you got to get practical experience through internships, through working post undergrad. I'm going to encourage all of you to work for at least 1 to 2 years, if not longer, after undergrad, before going to grad school, to make sure you know what it is that you want to do and be able to get into the best possible school. The third is to choose and actually actively pursue a direction. You can't just say, I want to go to medical school. You have to go back to what Jubin did and say, oh, I want to go to medical school. So who's going to write my letter of recommendation? How am I going to get experience before I go? Am I going to get my name on a publication? But actively pursuing a direction, going to the PreMedCC meetings, going to the UC Davis conference that Jubin started, those kind of things. And it's okay if you have like 1 to 3 directions, because one direction might be being a doctor, one might be being not being a doctor and being a health administrator like I am, and one might be not being a doctor, it might be becoming a PA or something, because you can still do the kind of work that you want to do with a lot less schooling, those kinds of things. So find those directions. Notice your educational preparation doesn't come until after you have chosen your direction, right? Because your graduate education should be specialized knowledge, skills, credentials, and connections to help you choose your direction. So until you know what it is you want to do, you're sure based on practical experience. Practical experience helps you know what you want to do. You have done that work to assess who you are and to know what's possible. Then you choose your educational preparation, particularly your graduate or health profession school preparation, because you want it to be aligned with what you want to do. I wanted to be a hospital administrator, so I got an MBA and a master in public health. I didn't get a master's in epidemiology. I didn't get a master's in public policy or city and regional planning or medicine, because I wanted to be a hospital administrator, and I got the right degrees for me. Then you got to learn to package yourself. It doesn't help to have a great degree if you don't have a good LinkedIn profile. I encourage all of you to strengthen your LinkedIn profile, your resumes, your ability to do interviews. Everyone should have an elevator speech. If you don't have one, you're going to need one. So that's your packaging. And by the way, in my book, there's all kinds of details on how to strengthen these things. And then it's either network or not work. You need a good professional network and personal support network, including those faculty that we talked about earlier, including the people that you shadow and intern with, including the peers that you're in the health professions clubs with, those kinds of things. And then you got to believe in yourself. It took a lot for me to take a 70% salary cut. It took a lot for a friend of mine to get accepted to Stanford Medical School and then tell his immigrant Indian parents that instead he was going to go to public health school because that's what he really wanted to do. That's who he really was. And now he's the chair of public health at a university, and his parents are very proud. So, and then finally, you're going to change jobs, you're going to change roles, your path is going to change many times, particularly in your lifetime. And so realize you'll be adjusting as the world changes and as your interests change. It's a lot different when you're a younger person versus a mid-career versus a senior person. It's different when you have you have older parents, or you have children or siblings that you need to care for. And there's a lot of different things that may impact your priorities. But if you follow this framework, I really strongly believe that you will achieve your authentic health career. You'll have a great life. For some people, they say, well, this is too much structure for me. Why do I need to follow this structure? Other people like the structure, and there's a saying that opportunity is where luck and preparation meet. So this is where the preparation part comes in. You will create your own luck, by doing this. So I'm going to pause here, and I bet everyone here, just raise your hand if you could benefit from some more exposure. Raise your electronic hand or put it in the chat. Everyone needs more exposure to what's possible. Wanting to see who needs to strengthen their practical experience, right? Almost everyone needs more practical experience. Most of you probably need to strengthen your packaging and your support network. And I bet a lot of you need to increase your belief and courage, right? So if you can follow this framework, and I would encourage you to pick like 2 or 3 of these that you want to work on. And it's a way to start helping you figure out what you want to do and get from where you are to where you want to be. So I'm going to stop here and see what questions there are about this. And then I will talk about Health Career Connection as one way to do all of this, because HCC is based on these things. So questions about this?
So this is a question. This person started their path as pre-med, but they discovered that they are interested in the business side um, of it,
Hmm.
um, and in their fourth year, they're now looking at a master's in biotech management.
Hmm.
Um, do you what recommend one or two key internships that you would recommend them to do?
Yeah, great question. Well, so biotech has really good very good internship opportunities. I don't know how the current environment is affecting the biopharma internships, but you're lucky in that the San Francisco Bay Area, the San Diego area, the Boston area, in some degree North Carolina, they have a lot of biopharma companies that are there. And so, for example, HCC, we used to partner with a company called BioMarin Pharmaceuticals, and they're based in Marin, as well as in South San Francisco. They have a whole summer internship program that probably the applications are out now, or they will be coming out very soon. And they have 50 to 100 internships that they offer. Same with the company, Genentech has internship programs in the area. Amgen, Gilead Pharmaceuticals in the area. There's some smaller organizations, blanking on their names right now, that the HCC used to partner with. So I would just go directly, I'd look at the kind of companies that you're interested in working with, and I would apply directly to their internship programs. And a lot of them are really designed to help you not only get exposure and experience, but then kind of get in the track to get a job in those organizations.
Yeah, I know that Genentech is recruiting for summer interns
Hmm.
this year. And then BioMarin as well. There's also um I can tell you in the Bay Area there's hundreds of biotech companies that are
Yeah,
always
yeah.
um
There is one association. I can't remember what it's called. It like the California, and look up what is the association in California for biotech biopharma companies. It's a life sciences alliance or something like that. Um, California Life Sciences, perhaps. That'll probably have a list of the different biopharma companies, and you can see what those companies are, and then you can look to see which internships that they have.
yeah, and the thing is for companies you have to look at their career section for internships. They don't have like a
Hmm.
um separate one, but there's a lot of them. And I know they're always looking for that part of it. All right. This is a good question. What common mistakes do students make when applying to summer internships, and what limits their ability to explore multiple specialties?
Yeah, really good question. I think first of all, it's important to follow the prompts on the applications that the internship programs have. Sometimes programs, for example, have like some short answer questions or a statement of purpose or something like that you have to complete, or like, why do you want to be in this program? Make sure you really carefully read the question that they're asking and then answer the question. Sometimes people want to cut and paste things from other applications that they have. So they're just quickly, applying to something, and they don't really take the time to go, oh, wow, that's kind of a nuanced question. Let me make sure that I answer that question directly. That's a really important one. Secondly, is to not use AI to answer your question. People want to read in your authentic voice, and we can tell when it's an AI generated answer. So making sure that maybe AI gives you some ideas, but please write it in your own words and your own voice. Um, Making errors on your people that have to submit a resume or a curriculum vitae, a CV of some kind. Make sure that it's done very well. Make sure that there's not spelling errors or spacing errors or grammar errors. Or if you have to write a cover letter, make sure there's no grammatical errors in there. And same with the responses that you have to the questions. I think waiting till the last minute, and I'm a last minute kind of a guy. I used to be, but waiting till the last minute is kind of rough because sometimes then you're rushed. Also, sometimes there's problems with submitting applications and things like that. So give yourself some time to get it done earlier. Get people to read your application, that know you well, and give you some feedback on what you write on your resume and those kinds of things. I think sometimes maybe being too rigid is important. People apply to internship programs. Sometimes it's like, I only want clinical experience working with a nurse practitioner in a rural community, working on women's health. It's like, okay, well, that's important to go for what you want, but being flexible enough so that if the internship, well, we don't have a nurse practitioner working in a rural area on women's health. We have somebody working in a rural area working on substance use disorders or something like that. And it's not a nurse practitioner, it's a MFT or something like that. Be open to it. I mean, go for what you want, but be open and flexible because I think it's not easy out there right now. And people want to see folks that are flexible, adaptable, and resilient. And you can learn a lot from all kinds of experiences at this stage. Those are some of my lessons. Jubin, what else would you say?
No, I think I mean, you can't mess with perfection, so I just keep it's kind of like, you can't touch up the Mona Lisa. The Mona Lisa is the Lisa. Um, this is they want to know how to build a network as a business admin major in community college. They want to do med school prereqs as well,
Mm.
but they want to transfer to Berkeley and Irvine. And what kind of timeline should they do also if they're interested in medical school?
There's a lot in that one. So it's great to have business and pre-med. One of my former students in Health Career Connection interns from Berkeley who transferred from community college to Berkeley. He transferred from Hartnell College in Salinas to Berkeley. Like he was somebody who started out being a business major and pre-med, at the same time. And uh, I think it gives you options. And I think the key is to still, as we talked about, health is a business. So do a good job in the business coursework. For Berkeley, the business school, if you want to transfer there, that it's an upper division major that you should learn like what are the requirements that they're looking for and how do you need to position yourself to transfer into a major like that. Talk to the advisors, talk to the peer counselors, those kinds of things. And then, give yourself time to do a good enough job on the business major, networking by being in the business school, business clubs, going to different career fairs, events that the business school has. They have more of that than other schools typically. And then give yourself a little time after. Don't plan on going to medical school right away because you might need some time after you graduate to still do some of those prereqs for medical school. One of the guy I was referring to, he ended up working for a little bit and then he said, oh, I don't want to go into business. I want to be a doctor. And then he really had to take extra time to do his MCAT studying and to take his coursework. So he didn't apply right away. He had a couple years, 2, 3, 4 years after undergrad before he went back to school. So I would say, just give yourself enough time and space. Make sure you know what it is that you want to do. Build the network by doing the things we talked about earlier, being in clubs, informational interviews, talking to your faculty, all those same things apply.
Can you have a career as a doctor before becoming a healthcare administrator, or do you
Absolutely.
need to have an MPH and an MBA degree?
So
Um,
you can be many of the best administrators can be people who have they have an MD only. You don't need to have one of those other degrees. It helps to have management training though, and because it's management's different than treating patients, even if you're a really smart person, which you all would be, you all are. A lot of people can get a certificate like in management, or they can be in the California Healthcare Foundation program for physician leaders, or you can get your MPH and MBA at other times along the way. If you know you want to do it, a good time to get your MPH or MBA is between the third and fourth year of medical school, because that's a time when um, it's a good opportunity to get a 1 year MPH or a 1 year MBA or something like that. Whereas afterwards, it'll take you 2 years after you already become a doctor. But yeah, you can become a doctor first and then become an administrator or vice versa. What would you add, Jubin, to that?
No, no, I'd just say that we had the CEO of the Permanente group, Dr. Ansari,
Yeah,
who only has an MD. She doesn't have an
right.
MPH, or also the guy who leads the Cleveland Clinic and Mayo. They're both
Hmm.
physicians that don't have MDs and
Yeah,
MB. I mean, they only have MDs, but not MBAs. And you can do business and management and administration without an MPH or
hmm.
MBA, but you cannot practice medicine without an
That's
MD.
right.
So
That's
take it
right.
take it how you would. This is a question they want to ask, and actually, you're the person who founded this program.
Uh-huh.
Do you know how competitive the UC Berkeley Public Health major is for undergrads and that
Yeah,
are
and
transferring?
I was one of the people on the committee. A couple other folks founded it, but I was the co-director of it for many years. It's competitive program. I don't know the current state. It's been a little bit since I've been there. It really depends on the capacity of the program these days and how many students are applying for it. It used to be that it was competitive, but because more it was just impacted, it wasn't that they were wanted to weed people out. They only had so many spots. I think the best answer would be to go talk to the undergraduate public health advisor at UC Berkeley and talk to them about the process now, because I honestly don't know, what it is at this point.
Make sure you look at the assist.org website and look at your community college and transferring into that major, and make sure you target as many or all of the prereqs. That's like the big one for transferring to UC, and that's on assist.org. And I could put it here, but you should know that as a community college, that's your Bible,
Yeah,
basically,
and
because
and need and also do really speak to the person. There is a designated advisor or advisors because they know the latest, and sometimes it changes. And
yeah.
so and plus you want to build a relationship with that person so that when your application comes up and oh, I met with that person and they were really cool. And hey, I do want to share. Let me share the HCC stuff just really quickly, and then we can talk a little bit more. So let me just share my screen here. Um, all right, so for Health Career Connection, I'm going to share with you about HCC. So Health Career Connection, this is our 35th year, and we are all about helping undergraduate students and recent graduate, particularly folks from first in their family to go to college or low income backgrounds or underserved communities, to achieve that authentic health career we talked about. We have 5,800 alums who are doctors, they're pharmacists, their PAs, their health administrators, their behavioral health specialists, folks that work in primary care, public health, health management, behavioral health, health policy. And we're the connection between what the students are looking to do and what employers and graduate schools are looking for. And so we really want to help you all to increase your awareness of what the possibilities are, as we talked about before, to advance in your health career path, your authentic health career, and to find the mentors to build the skills to do it, to try to get that first job out of college, which is really important and not easy to do, and help you become a more competitive applicant for health profession schools and build that network and sense of belonging and community to do the work. And this is a paid summer internship program. Our internships have had great experiences. People figure out what they want to do, they get mentors, they get job offers, they, get confidence that you all can succeed. Here's an example of one of our alums who, he said, "Hey, HCC helped me really understand what was possible. It really got me connected to my professional path, helped him get a job, and these kinds of things." We partner with leading public health and graduate schools, medical schools around the country. We have a new partnership with Meharry School of Global Health, for example. But you can see we've got the Berkeley, Stanford, UCLA, UCSD, others that are part of our network UCR. These are all medical schools and public health schools that our workshops are in partnership with these folks. The faculty and students, admissions people are reaching out to you. 82% of our alums in HCC have gotten a graduate degree and gone on to these kinds of schools. So our internships are 10 weeks in the summer, They're about these areas: public health, health management, behavioral health. You get a stipend anywhere from 5 or 6,000 more. Many companies are paying more than the 6,000, so it's a full-time paid educational experience. We do this in 14 regions of the country, all throughout California. You can see we have 5 regions in California, ranging from Northern California up in the Sacramento area, all the way down to the border in San Diego and the Coachella Valley and the Central Valley, the Central Coast. We have and in other parts of the country too, including our new regions in Denver and in in Tennessee. We have a hands-on approach. We help you get exposure and experience. Remember the first 2 or 3 parts of the framework that we use? You learn by doing, by an internship placement. And then you get mentorship from our team, from your preceptor. You build community amongst your cohort of other people from all different schools who are applying. We have a whole range of summer workshops ranging from skill building around Excel and writing and project management to which career path you want to pursue, how do you get into graduate school, how do you pay for it, answering those questions like you asked earlier, how do you get a recommendation from somebody you haven't spoken with for a while, and we connect you to those graduate school partners. It's an apprenticeship kind of a model where you work under a preceptor. It could be a hospital, it could be a community health center, could be a behavioral health organization or a consulting firm. And you learn, but you contribute to the organization, you contribute to the community as well, which is really important. And then you learn how to navigate your health career path. You build relationships. We have national leaders like PreMedCC has great leaders coming in. We've got leaders that are coming in and out, talking to students. You build friendships with folks in the program and the people that you meet. You get connected to employers. You really help to advance what you want to do. These are some examples. The students built their professional skills. They learned how to network. They had a mentor. They got a job offer. And so, we work with all kinds of hospitals and health centers, public health departments. We work with, behavioral health organizations. We have a community health leaders program for those folks that can't do a full-time in-person or remote or hybrid summer internship. If you're studying for the MCAT, if you're taking summer school, we have a 20-hour week program where you can work on team-based projects and still learn all the kind of things that we shared, but it's for 8 weeks part-time instead of 10 weeks full-time. Some of our alums, you can see here we have hospital CEOs. We've got the Chief Business Development Officer for Kaiser. We've got Vida Limon Rocha, who is a child, adolescent, and adult psychiatrist in the Inland Empire. Denise Ferraza is the Chief Public Health Officer for City of Detroit. So these are the kind of folks that you would be following in your footsteps, and they'd be in your network. What we don't do is clinical shadowing. We don't do clinical lab kind of experiences. We don't do academic research. We don't do graduate internships or international internships, and you have to have your own housing. You have to be an undergrad, either in community college or a 4-year college. And you can be a recent grad, like I got a text this morning from somebody who said, hey, I've been out for 2 or 3 years. Can I apply to HCC? The answer is yes, including post-bac students, but you can't be a grad student. You can't be in a dual enrollment program. And if you are a DACA recipient, or if you have an ITIN or you're applying for one, then you're eligible for HCC as well. Our participants come from community colleges, 4-year schools, HBCUs, a wide range of schools. You heard me, I'm from the CSU background. We love people who are from pipeline programs, all that were part of the Doctors Academy, or the Aspiring Physicians program, or that Summer Health Professions Education program, 10,000 Degrees, the FACES program, SMYSP. We love people that are in the California Medicine Scholars program, and we have a lot of opportunity for folks there. So these are who we want to partner with. And the application is open. It's live at our website, healthcareers.org. The deadline is midnight on December the 9th, but as I mentioned earlier, don't wait till then. Then if you get selected, you'll get interviewed in January. And then you would go out to interview with our host organizations that February to March timeframe. the program would be in the summer. So yeah, that's a little bit about HCC. So what questions do you all have now?
Um, this person wants to know, uh, they're a senior in high school graduating in June 2026. Will I be able to do these internships or only if I'm in college?
Great question. I wish we could offer them to you and as graduating from high school. I love your ambition and I'm going to encourage you to apply when you are in college because these internships I just mentioned are just available for people who are in college and so we'll be waiting for you when you come to college. Honestly, for Health Career Connection, it's probably more they're most appropriate for people who are between their junior and senior year or between their sort of senior year and graduation or they've just graduated, or between your sophomore and junior year. So we'll give you just a little bit more time to get a little more life under your belt, and then we'll be waiting for you.
Yeah, and I would just say that there are programs, and I don't know where you're located at, but there are a lot of summer programs for high school students.
Hmm.
I know UCLA has a couple, Irvine, USC has one.
Hmm.
There's a lot, like if you just look at like we don't do a lot of high school things, so I'm not like I can't, and I don't know where you're located, but there's programs that you can look at that are just for high school students, and a lot of it has to do with having, minors, being around minors. It's an extra layer that a lot of institutions are
Hmm.
not willing to partake.
Right.
So, you know, uh, yes, and these are all paid program. These are all paid.
These are all paid intern. Yeah, HCC only offers paid internships. You all are worth it, and you add value to the organization. And we know that we don't want there to be a barrier for people to get experience, right? So that they're all paid. Yes. And the
Do you
programs
have
that
them in
even that you're paid
Hawaii?
to.
I want to go to Hawaii.
Oh, you know what? We one time had one of our host organization preceptors who went from San Francisco to Hawaii and to Maui, and she said, "Oh, let's start up a Maui version of the program." I said, "Well, Juba and I would be happy to go do research to make sure that it's a good opportunity, but we don't have any in Maui just yet, in Hawaii yet, but maybe in the future, maybe in the future." Yeah, but I encourage you to apply. If you want more information, we have a webinar on Tuesday for Health Career Connection. If you go to our website and register, but by the way, if you register at our website for the internship, you'll get more information, and it's no obligation. It's not, you're not applying yet. But we have a webinar at 5 o'clock this coming Tuesday with more information about HCC. Some of the same that you just heard, but maybe some more nuanced information.
Yeah, if you ever need research for Hawaii, I'll do
That's
it for
right.
you.
That sounds good. Yeah. But I encourage you to apply. People have really had amazing experiences as a result of HCC, and we're confident that you all will as well. It takes a little bit of time to do the application. You have to fill out some short answer questions, but it's mainly like, hey, so where are you from, and how did that affect who you are and what you want to do? What are your health career interests at this time? What do you want to get out of the internship? It's things like that you want to be able to answer anyway, and take your time and do a good job on those. Minimalist answers like one or two sentence answers is not what we're looking for. We're looking for somebody who can say, hey, I'm from the Central Valley. I grew up in this community. I had challenges with access to care, or I saw that, now I want to be a doctor and I want to work on these kind of issues in primary care. And take your time and write it what it is that you want, because we're looking for fit. Ultimately, that's what we're looking for is who's a good fit for the program and how can we best help you and how can you succeed?
So somebody was asking what's the percentages of people that apply that get in, and I'm gonna jump in and say I have this inside track data that Mr. Oxendine shared with me. And the data is that 100% of people that don't apply, they're not going to get in. So instead of sitting here saying, well, what are the chances if I apply? What's the percentage of it? It's like, first of all, that's kind of like predicting because we don't like Mr. Oxendine doesn't look in the crystal ball and say, well, this year,
Right.
5,000 people are going to apply or 1,000 people are going to apply. So that's one thing. Second thing is you don't know what the applicants are. Maybe there's some people that are highly qualified, or maybe people that are less qualified than you, and make mistakes that you won't. And the application does not cost anything. It's free.
That's right.
So yeah, so you don't really, doesn't cost you anything. It costs you the most important thing that you have is time, and the time that you invest in yourself to apply for this program or any programs. And we've had a lot of summer programs that have come and talked to you. That's an investment you have to do, and you have to make that decision.
And it's not a numbers game at all. We don't go, oh, we're gonna accept X%. It's based on a good fit. Like we look to see, oh, this is who you are, this is where you're from, this is what you want to do. Here's some of your skills. Then we also, our goal is to place as many people as possible. And the only limiting factor is how many organizations will pay to host the intern or how much grant funding that we have. But we're not trying to reject people. We're trying to accept people, and we're trying to make sure it's a good fit for them and for us. And so yeah, 100%, if you don't apply, you're not going to get in. If you do apply, you've got a shot. And so and plus it's a good experience. Like part of why we have our application the way it is, it makes you think about who you are and what you want. It makes you practice putting forward your resume. It makes you practice interviewing. Like these are all good things anyway, to be able to do. So I encourage, please apply.
Yeah, and the deadline again is December 9th at midnight. Now, please don't email us asking us to write an email on your behalf to extend it. We can't do that. Um, so please don't do that. But yeah, um, it's basically whenever it's a program that you should look into, apply, and unfortunately, if you don't get it, it's not the end of the world. You could, make it a learning experience, but yeah, this is the website again. People are asking for the website. It's like, okay, here you
So
go.
I want to emphasize something that Jubin said, which is that we if you don't get accepted the first time, oftentimes it's because, oh, you're only a freshman or you're only, sophomore, or you haven't figured out how to articulate what you want to do yet or something. And so we have a lot of people who don't get in, not because they're not really amazing candidates for becoming health professionals, and not because we don't need you, but because maybe it's not the right time yet. So if for some reason you don't get accepted, please apply again, if you think it's a good fit for you, and it will help your chances of getting accepted. And the practice maybe of applying or interviewing would be good no matter what. But do apply with confidence. Please apply with confidence.
Yeah, and then the other thing is that this is the $64,000 question. What do you look for
Yeah,
in
well,
it?
so you probably heard from medical school deans about a holistic review process. We do the same thing. We look at many facets of your application. There's not one or two things that we hone in on. We look at where you're from. Some communities are more medically underserved. We're trying to have people that are from more medically underserved communities be able to have opportunities. We're looking at your interest in the type of opportunities that we offer. Again, if you say, hey, I'm interested in bench research, or I'm interested in biopharma research, or I'm interested in a clinical shadowing for the whole summer, that's not what we offer. We offer the internships in the management, policy, primary care, those areas. We do look at your educational experience, but we're not focused on your GPA. We just look at, oh, what major did you have and what have you learned so far? We do look if you've had some kind of health related experience, whether it's a volunteer or shadowing or a student club or a peer health educator or something like that. We look at if have you worked. So even if you haven't no health experience, but you worked in customer service, you worked at fast food or retail, and we know that, guys, that's responsible. You had to show up, do your job, you had to work with the public, or if you worked in the fields, we know how hard that work is, right? We look at your lived experience, like how much, what have you overcome to get where you are? What's your distance traveled? Did you have economic hardship? Did you have educational challenges? Are you from a rural community? Like those kinds of things. And then we say, hey, are you the first in your family to go to college? Did you have any leadership experience? Like particularly some people, they were leaders, they were RAs in their dorms, or they were president of their club, or they were in a fraternity or sorority. They were on a sports team. They were involved in church activities, right? Are you interested in improving health for all? Are you flexible, adaptable, and resilient? Can you do your internships in the areas that HCC is located? Were you part of one of these health pipeline programs that we partnered with, like the Biology Scholars Program at Berkeley or something? So it's a combination of these things. And we want people to do a good job on their application, write good short answer questions and interview well. And so it's a combination of things. So it takes some time. But you all, many of you are going to be well qualified candidates.
Yeah, the other question is somebody was asking, what is a day like of an intern for this?
It's a good question. It really varies by the type of internship, and each internship is different. Everybody's not going through a similar program. It might be different for someone who is an intern in a community health center in Bakersfield compared to a hospital in San Diego, compared to a public health department in Oakland, right? And so that's part of the process is if you're selected to go to the interview process with the host organizations, you find out what kind of projects do they have? What kind of responsibilities would you have? It varies, and that's why we want to know about your interests and your skills and those things. But a lot of times it's a combination of maybe three or four things that people would do during a day. The first would be they'd work on some projects, maybe one or two major projects in their host organization that usually is aligned with their interest or is a good learning opportunity. The second is they attend different meetings. Maybe you go to the meeting of the board of supervisors, or you go to a management meeting, or you go to a community meeting or something. So you get to see in action, like what is it really like to be a professional, in these settings. And then the third is Health Career Connection has workshops. So every week we have probably 3 to 6 hours of workshops every week. Some are virtual, some are in person, and you go to those workshops and you learn from the workshops. And then finally you might just have some other kind of duties that you would do that you get assigned, that maybe it's not like a project, but today they go, oh my gosh, we need somebody to go to this hearing in Sacramento and observe, come back and give us a report on if they're going to pass this behavioral health bill or something like that. So it's really meant as an educational learning experience for you through a combination of those different types of activities.
Yeah, and I would just say that somebody asked in there, should I just like reach out and do an internship on my own? And it's like, well, you could do that, but the issue is that these programs, like they have funding, so they're going to pay you first. The other
Hmm.
stuff won't be able to pay you. Second, they have committed to having you there. That means that they have somebody that's doing that is able to
Hmm.
to do that, and so they're paid to support you. They're not doing it as kind of a side project, but they're committed to this, and so they're going to give their time and effort and knowledge and wisdom and everything to you versus just like, oh, this person's here, you know and I know a couple people that have done this. You're not going to show up and copy papers or
Right, right.
file stuff. This is not like they want you to be part of it. You go to meetings, you do various things. And so that's why it's so important doing your program than just um just some and those are great as well. So, you could do that.
Yeah.
But I would say these programs are formal, they pay you pretty good money. And
The other thing I would add is that in our program, it's a cohort program. So you have other students, maybe from some from your same school, some from other schools that are coming together and doing this at the same time. So I think one of the things we hear the most that people get out of this is, oh, I met all these other people who are interested in pursuing, health career options, and I built all these new relationships and friendships, and I got peer support now that I didn't have before. I have a sense of community. I have a sense of belonging. Yeah, those are the kind of things and I have a professional network that I have access to now, all those 5,800 alumni who've been in the program. And also you have an identity. Like going forward, and I guarantee you the medical schools in California, the public health schools around the country, they know who Health Career Connection is. Like when you put that on your application, on your resume, oh, that's an HCC person. We've had other HCC people before you, and those people have turned out pretty good. So you kind of have that association, that brand name now that's part of what you do. And so absolutely, you should pursue your own internships, and you should also try to be part of programs like Health Career Connection, like that summer health professions education program. The CDC, I'm not sure if they still have it, but they had like a John Lewis internship program also, may have gotten canceled in this environment. I'm not sure, but that you want to be in these brand name programs. Kaiser Permanente Launch, KP Launch is another program that is an internship program that Kaiser offers. Those credential you in addition to the what you learn from it. So Juben, I'm gonna have to go here in just a couple minutes.
Yeah, we have to go too. We have another session.
Yeah, okay, yeah.
One last question
Okay.
is, what something you know now that you wish you'd have known before? Is there anything that you would have done differently?
I would have believed in myself more and what I really wanted to do, and um, trusted myself more in terms of some of the. I made good choices, but and I'm fortunate how things have turned out. But I think just believing in yourself, trusting yourself is really important. Um, and also I would just say that fully going for what you want and being bold, and knowing that mighty forces will come to your aid, I think is really important as well. And finally, the network or not work. I think networking is really key. And so I appreciate all the questions you asked about networking. So building that network is everything, particularly now in this world that we're in, particularly with more people applying for things with AI now. Anybody can apply to anything. You just have an AI cover letter, AI resume. So organizations are going to be saying, okay, well, who referred you for this position? And who do you know? And it's going to make a difference. So, and knowing Jubin is a really great person to know. Thank you, Jubin, for including me, for your friendship over the years, and for running this amazing organization that you do. And thanks to everybody. Hopefully, we'll see you in HCC or in the health career field.
Thank you, Mr. Oxenine.
Thank you so much. Take care.